we have a limit time. We will move to third session. Yeah. Okay. In this third session, we have three presenter. Yeah. First is Miss Fatihah Maurisna, Nurul Jadid, Mrs. Nurul Jadid, and Mrs. Siti Kurniawati. Okay, for the first presenter in the third session, yeah, the first presenter is Miss Fatihah Maurisna Asfahani from the Bandung Institute of Technology. She will present the paper entitled In Silico Investigation of Potential Anti-Liver Inflammatory Agent in Brazilian and Indonesian Propolis, a comparative study. Okay, Ms. Fatihah, you can present, start from now. Time is yours.
Okay. Do you hear me, Mr. Kausa? Hello?
Okay, I can hear you.
Okay. Wait a second. I would like to share my presentation. Okay. Thank you for giving me an opportunity to present my research study. So allow me to introduce myself first. My name is Fatihah Maurisna Asfahani, and I am the graduate student from Biomedical Engineering Department in Bandung Institute of Technology. So in this section, I would like to tell you about my research study in silico investigation of potential anti-liver inflammatory agents in Brazilian and Indonesian propolis comparative study. Okay. Before we start the explanation of this research study, I would like to tell you the overview what we'll discuss later. The first one is the introduction and the purpose of the study, and then the material and method that we use, and then the result and analysis, and the last one is the conclusion that we can get in the study. So generally, we know the liver cirrhosis is end stage of chronic liver disease, such as non-alcoholic fatty liver disease and non-alcoholic steatohepatitis. So from Auspicic et al., the case of this disease, especially the non-alcoholic steatohepatitis, is predicted to increase by 63% between 2015 and 2030. So liver cirrhosis is characterized by extreme liver scarring, and it can cause loss of organ function and several serious complications. The liver cirrhosis is caused by the inflammatory response, especially in the liver. So several cells have to play a role in inflammatory pathway. The study suggests that the hepatic stellate cells and the Kupffer cells play a role in inflammatory pathway. So wait a second, I will use the laser pointer. The research study suggests that the toll-like receptor 4, this pathway, and then the tumor necrosis factor alpha signaling pathway has a role in inflammatory response by producing inflammatory cytokines. So from Follow-Fit et al. Tell that there are currently no FDA or European Medicine Agency approved for antifibrotic or pro-regenerative drug therapies, especially for cirrhosis. Mostly to treat the liver cirrhosis, usually people by doing liver transplants, but the resources are very limited. So generally, the NSAID or non-steroidal anti-inflammatory drugs were used to reduce the inflammation. But this drug has many side effects. So therefore, the alternatives are needed, such as developing herbal medicine. One of them is propolis. The recent study suggests that the propolis has a potential as an anti-inflammatory, antioxidant, anti-cancer, and antibacterial. So this study are using the molecular docking process, and we know that the drug molecular library and the target protein were computed and on computational docking, and this computational docking were determined the binding pose as a conformation and the orientation and calculate free energy of binding, and we got from the highest core molecule. So the figure showed that the the more negative value of binding affinity has the greatest stability than the positive value of binding affinity. So the purpose of this study is to investigate a better inhibition between Brazilian and Indonesian propolis compounds as new candidates for anti-liver inflammatory agents. This is the material and method that we use in this study. So first, we prepare the ligand. As much as 43 propolis compounds, such as 22 are Indonesian propolis and 21 are Brazilian propolis that were taken from the PubChem. So at the same time, we prepare the protein target from the TLR4 and the TNF alpha phenyl pathway that I told before from the FCSE protein database. And then we looking for the binding site using the CASTP, and then we're looking for the positive controls that were binding with the protein target that we use as a comparison with Indonesian and Brazilian propolis. After the preparation, the ligands and the protein were jotted using Pyrex, and some potential ligands hit in this step. So after that, we visualize the ligand and the receptor using Bioinformatics Discovery Studio to know the molecular interaction between them. After that, we use ADME and toxicity analysis to know the good characteristics of the compound. And then we're using online web server using SwissADME and admetlab.scbdd.com, and we got some potential ligands with ADME properties. So this is the 6 protein target and the PDB-ID that we use in this study, including the TLR4-NG2, and then the TNFR1, TNF-alpha, and then the myeloid differentiation primary response 88 interleukin-1 receptor, and then the P38, and then the nuclear factor kappa B, and the TAK1. So we got on the result section. This is the summary of the results for the all 6 protein target that we use. From this table show that all 6 protein targets have some potential propolis compounds, such as Indonesian propolis and Brazilian propolis, which have the lowest binding affinity than the positive control. And this is the positive control that we use in the study. And then from the potential propolis compounds, the compound which has the lowest binding affinity than the other compounds will show in this table. It's Indonesian propolis and Brazilian propolis. And this is the binding affinity value that we know that the compounds have the lowest binding affinity than the positive control. So these are on the visualization between the ligand and the receptor binding. This one, you know that the Brazilian propolis were dominated for protein targets, and then the Indonesian propolis has two protein targets. And we know that this visualization between the ligands which have the lowest binding affinity than the other compounds have the same type of bonds. So especially the hydrogen bonds, P bonds, and so on. So the hydrogen bonds have the greatest bond strength than the other type of bonds. So this is the result of ADME and toxicity analysis. So ADME is absorption, distribution, metabolism, and expression that we know from the potential compounds. This is the propolis compounds that have a good characteristic from the ADME properties in this table. So after we analyze the ADME, we analyze the toxicity with the LD50, and all Brazilian propolis compounds and Indonesian propolis compounds in here that has likely toxic, except the flavinochromin C, 3,4,5,3-hydroxy 7-methoxy 8-isopentanylflavone, and icaritin. So we analyze the hepatotoxicity too, and the results state that the delphinidine, isoetin, and morin have a non-toxic characteristic, and only 3 compounds have the non-toxic characteristic is from Indonesian propolis. So this is the conclusion in this research study. So we know that all Indonesian propolis and Brazilian propolis have a potential as anti-inflammatory agent in the liver. It was found that on binding affinity value, Brazilian propolis was dominate as indicates a better action of inhibition than Indonesian propolis compounds. But Indonesian propolis compounds were also potential anti-liver inflammatory agents. So for the ADME and toxicity analysis, innocent propolis compounds have the potential to be used as anti-inflammatory agents in the liver that have a good characteristic. It is also supported by the results of the LEUT50 toxicity test and the hepatotoxicity too. This is the end of my presentation. Thank you.
Okay, Ms. Fatiha, thank you for excellent presentation. Okay, we move to second presenter. It is Mrs. Nurul Jadid Mubarakti from the Brawijaya University. She will present her paper entitled Profiling of Antivirus as Excellent Agent from Active Compounds on Citrus and Mangosteen Peel using in silico study approach. Okay, Ms. Nurul Jadid, time is yours.
Thank you. Izin untuk share PPT. Suara saya apakah sudah terdengar?
Ya.
Okay, ladies and gentlemen, let me introduce. I am Nurul Jadid Mubarakti from Universitas Islam Malang. Today, I would like to talk about profiling of antivirus as excellent agent from active compound on citrus and mangosteen peel using in silico study approach. Coronavirus disease is caused by SARS-CoV-2 and represent the causative agent of potentially fatal disease that is a great global public health concern. Based on the large number of infected people, its sequence person-to-person transmission of COVID-19 infection led to the isolation of patients that were subsequently administered a variety of treatment. To reduce the risk of that, the Ministry of Health recommend vitamin and drugs to treat COVID-19 patients, but two of them are expensive and have side effects. The discovery of drugs based on natural ingredients is an alternative is exploring Indonesian original natural resources. Discovery of medical plant based on localism and zero risk is potential key to finding antiviral agent. Generally, antiviral agents from natural ingredients are much safer than synthetic chemical. One of the plants that live in tropical or subtropical areas, and it believed to be antivirus agents are orange and mangosteen peels. Currently, the identification of active compound in orange and mangosteen peel and their potential for antiviral through in silico approach has not been widely carried out. It is important as initial step in minimizing vulnerability that cure during the clinical trial stage. Seeing the content which contain many useful compounds and ways the has not been properly optimized, we intend to analyze the potential of the active compound of orange and mangosteen peel as antiviral agent based on in silico analysis before in vitro or in vivo testing. The aim of this study was to analyze the predict ADME and toxicity profiling, and also the affinity bond between the active compound in orange and mangosteen peel as antiviral. This This research uses an in silico study approach through molecular doping analysis and ADMET toxicity screening using the PUI-PT as an online tool program. The test ligand used were 27 compound and one active ligand compound as a control. A recept PubChem database was applied to get the smile structure used for further analysis. This analysis was carried out tracing ADMET and compound toxicity using PKCS and online to progress. Next step, receptor and ligand that have been prepared are continued in the doping stage. The molecular doping in using PYREX software, molecular doping validation and visualization was carried out using Pinel software. To see the interaction generated from molecular docking, we using both via discovery studio software. The table show that food absorption according January 2070 if it has more than 80% and food absorption if it's less than 30%. The active compound from orange and mangosteen peel are estimated to have high K-co-2 permeability. With regard to its intestinal absorption, absorbance less than 30% is considered poorly absorbed. The single so a compound has overall compound has high permeability of K2 and it's easy absorbed. On this study, all of the test compound can be predicted to have a 70% K2 permeability. In table 1 and 2, the log BB value is between 70 until 81.5%. This indicates that it has good ability to penetrate the brain barrier. Prediction analysis ADMET and toxicity of active compound in orange peel so that it has criteria to be non-toxic drug candidate, while mangosteen peel meet the right dose to be consumed. Based on the physicochemical properties and toxicity using ADMET, it is known that more than 80% of active compound of orange and mangosteen peel have properties similar to criteria for drug and mild to moderate toxicity, so they have potential as antiviral drug. This table 3 show that there were 10 active compounds that had free energy bond from active compound, a cool potential for antiviral, and the amino acid residue have a 41 residue that interacting with hydrogen and hydrophobic bond. We conclude that ADMET value, toxicity, and binding affinity tests indicate that the main compound from orange and mangosteen peel is right combination, and it is recommended as a potential antiviral treatment. Thank you for Universitas Islam Malang for providing research funds of University Institutional Grant Scheme in 2020. And also we thank you Radita Intan Aisyah Pratiwi for providing database of active compound. Thank you for attention. Assalamualaikum warahmatullahi wabarakatuh.
Okay, thank you, Ms. Nurul Jadid, for the good presentation. Next, the last presenter, that is Miss Siti Kurniawati from Brawijaya University. She will present the paper entitled Structure Prediction Model of Pyrazinamide Resistance Mutation in PNCA Gene of Mycobacterium tuberculosis. Okay, Miss Siti Kurniawati, time is yours.
Okay, thank you. I'm sorry, I couldn't find my Zoom. Okay, please wait. Can you see my presentation?
Yes, I can see.
Okay, thank you very much. Good afternoon, ladies and gentlemen. My name is Siti Kurnia. This time I would like to present my work regarding the structure and prediction model of pyrazinamide resistant mutation in PNCA gene of Mycobacterium tuberculosis. And our member team is me, Siti Kurniawati, and also Nurhamdani, and also Sanarto Santoso. We are from Department of Clinical Microbiology, Faculty of Medicine, Brawijaya University. Okay, this introduction. As we know that tuberculosis is one of infectious disease caused by Mycobacterium tuberculosis, and Mycobacterium tuberculosis is one of member group of Mycobacterium tuberculosis complex, as well known as MTBC. MTB is one of the still big health problem in the world wide. Based on the WHO of Global TB report in 2021, the estimate of incident TB case in the worldwide, India, Indonesia, China, the Philippines, and also in the South Africa. And Indonesia still have in the 5 big country for the estimate incident TB cases in the world. And also regarding the drug resistance of TB, many reported regarding drug resistance such as isoniazid, rifampicin, ethambutol, and also pyrazinamide. This in 2017 and until 2019 regarding the MDR or RRTB increasing by 10%, and this like a country India, China, the Russian Federation, Indonesia, and Angola. And Indonesia still in the top big 5 regarding in this case. In our studio regarding the multi-drug resistant, we focus on PZA or pyrazinamide resistant. As we know that pyrazinamide is a first-line drug recommended by WHO for its treatment of TB, and this is some of mechanism of action regarding the pyrazinamide. Pyrazinamide in a Mycobacterium tuberculosis, which will encode or converts in pyrazinamidase and also into pyrazinoic acid. This is a function is inhibit fatty acid synthesis type 1 with this essential enzymatic complex that contributes to the virulence factor of NTB and also to replicate in Mycobacterium tuberculosis. But when the pyrazinamide resistant, which encoded by PNCA, the some mutation in this case, how the mechanism of action. So it might be mechanism of resistance is to mutation in PNCA, which pyrazinamidase is could not be kill the mycobacteria. So this is one of the important thing that we have to know regarding the PNCA. This is our material and method. We use a template of amino acids from the NCBI, which is a number of NP2175559.1, and also we try to reconstruct it in PNC agent, which as follow W6HR, and also until the V 157G. This also we got based on the literature review of the journal why we use this PNC18 and the site of location of a mutation, because many reported regarding this location and of a mutation in as a reported and some also unreported mutation. And also we try to modeling structure in Swiss model, like the homology of structure. We use a template T3PL1.1.a, and also we got the structure, and we analyze how to the model regarding based on the wild type and also the mutant that we have to reconstruct it in PNCA. And this is result and discussion, which wild type RV 204TC, and this is some of the mutation sites and the location 1, 2, 3, 4, 5 until WX9 8R. And in result, our study, this is not a significant difference regarding the wild type and also the mutant type. Have to in the building a model in the protein like this. And also we try to find differences, but in our study regarding the building and also eosinability and also hydrophobicity, there is no some significances different regarding the mutant and also the wild type. Okay, that's on the sake. They said that PNCA is one of the important gene regarding gene regulation regarding any PZA mechanism of Mycobacterium tuberculosis. As mentioned above, that pyrazinamide convert to pyrazinamide into POA. That's responsibility to inhibit the fatty acid in synthesis type 1. And also regarding the reconstruction of mutation in PNCA gene, this we don't have some significant difference, but based on the Scorpio and Zhang, some cases is the regarding the PZA resistant is also same called like false resistant, and our study has no significant difference the mutation in 3D structure, but it doesn't mean has not the effect of the MIC of Mycobacterium tuberculosis. So we conclude that resistant, it might has contributed other gen regulatory gen with such as RSPA. This is based on the Khan et al. And also Seh et al. And this is type that we need to study further. And our conclusion that mutation that have we reconstructed in PNCA gene, there is no significant differences, and also maybe we need to study further regarding the other gen regulatory such as RSPA gene, PND, and also CLPC1 gene regarding the PZA resistant in Mycobacterium tuberculosis. Okay, thank you.
Okay, thank you, Ms. Siti, from the good presentation. Okay, we move to last Q&A section. Yeah, there is one question for Mr. Fatiha. Yeah, this is from Anissa. Can you tell why did you conclude the Brazilian propolis better than Indonesian propolis for anti-liver inflammation? Okay, maybe you can answer.
Thank you for your giving me a time to answer the question. Thank you for Ms. Anissa for the question. Basically, based on the result of our study that I get in this research, has Brazilian propolis has more compounds that which have the lowest binding affinity than the Indonesian propolis, especially. So we know that from the visualization, the Brazilian propolis compounds have the lowest binding affinity than the other compounds in for protein target. So I suggest that the Brazilian propolis has a better potential than Indonesian propolis compound. Thank you.
Okay, thank you, Ms. Fatihah. Yeah, because it's a limit time. We finished the parallel session. Yeah, thank you for all participants. Yeah, if you have a question, maybe you can contact by email. Yeah. Okay. And to all participants, please don't leave because after this session we will announce the best presenter and the best poster. Okay. Thank you very much for the attention. Yeah.
Okay. Thank you, Mr. Kautsar, for moderating our sessions in this panel session today. So to ladies and gentlemen, to all presenters and also the participants of the conference. So we would like to inform you that we are going to have the announcement for the best posters and also the best presenters in the conference. So please, after this, we will be requiring you to be gathering in the main hall. All right. So please just leave the room. Do not just leave the breakout rooms, leave the meeting. Okay. So thank you, and we'll see you in the main hall. Okay. Have a nice day.
Hello, everyone, all of participants of the international conference, the fourth of MBC and also the third of MCLS 2021. Welcome back to main sessions of the event. Before we proceed to our very first main agenda for the announcement of the best presenters and also best posters, we would like to waiting for the judges to have the scores of all of participants of this international conference for the poster and also for the presenters. So please kindly be waited around 10 or 15 minutes. So meanwhile, we would like to present you some video of Universitas Erlangga